National Cancer Institute-Maharagama is the tertiary reference centre for cancer in Sri Lanka. Hence, it is one of the leading healthcare institutions in the country. It has consistently been at the forefront of providing exceptional healthcare services to cancer patients. This hospital had more than 70,000 patient admissions in the last year and around 13,000 were registered as new patients. The hospital conducted nearly 300,000 clinic visits last year. Known for our pioneering work in the chemical pathology laboratory, our team of dedicated professionals strives to deliver the highest quality care. Although medical lab science professionals may not have much the patient-facing roles that clinicians and nurses do, their work is not any less rewarding or impactful.
The Department of Chemical Pathology features 3 individual units: the General Biochemistry, Specialized Immunological Section and the Molecular Biology Section. The General Biochemistry section mainly deals with the 2 types of patients. We serve the OPD patients and in-ward patients. So, usually in the morning hours, we serve about 500 OPD patients and about 500 ward patients. And in the immunology or the specialized sections, we do all the basic tumor markers which are required in the diagnosis process and to assess the treatment success and in the long-term follow-up. So, we do PSA, CEA, AFP, beta SCG, 19.9 and 15.3, the basic tumor markers, as well as some specialized tumor markers. And these tumor markers, we give a island-wide service because these markers are very expensive, and here we do it free of charge. We do the comprehensive investigation panel in multiple myelomas, serum protein electrophoresis, urine protein electrophoresis, immune fixation, serum pre-light chain assays and beta-2 microglobulin assays. Again, we give the island-wide advisory services and the diagnosis services in the management of multiple myeloma. Additionally, we are a specialized center in the diagnostic procedures of neuroendocrine tumors, where we perform chromogranin A, 5-HIA, metanephrines and VMA. We give a island-wide service in these testings.
Here provided is the breakdown of different types of chemical pathology tests performed during the last year. It is presented in a table format for easy visualization. Now, let's move on to our case-based discussion on how lab saves life.
40-year-old lady was suffering from backache and lower abdominal pain for 1 year duration. Later on, she was found to have a subnephrotic range proteinuria. Then a renal biopsy was performed, which gives the diagnosis of amyloidosis as the apple green biofringence was positive. On further workup, serum protein electrophoresis was performed, which shows a monoclonal band in the gamma region.
Serum-free light chain assay showed free kappa of 14 and free lambda of 126 and bone marrow plasma cells of 20% aids the diagnosis of AL amyloidosis. Further, troponin I, NT-proBNP were done, stating stage 1 AL amyloidosis. She referred to a bone marrow transplant unit and underwent autologous stem cell transplantation. She gained a good response to treatment. Currently, she is followed up with erythropoiesis and serum-free light chain assays.
In our laboratory, we perform serum electrophoresis by using both gel electrophoresis and capillary electrophoresis methods. For further investigation, we perform immunofixation and also we are doing serum free light chain assays. In that case, we are using immunonephrolometry method, which is more sensitive than immunoturbidometry.
proteinuria තත්ත්වයක් කියලා. ඒකට අදාළව වැඩිදුර පරීක්ෂණ ලෙස kidney biopsy, adipose biopsy, SPG light chain පරීක්ෂණ සම්කරා අමුතුව සයගත්ත මට amyloidosis තත්ත්වයේ තියෙන කියලා කිනෝ අවුරුද්දක් දුන්නා. සේමෝඩ් මැරෝ ට්‍රාන්ස්ප්ලාන්ට් කරා. මම සුවදාත් ඉන්නවා.
64-year-old patient presented with generalized body weakness, vomiting and confusion for 1 week duration. His examination was uneventful except for reduced air entry in right side lower zone. On further evaluation of this patient, it was revealed that he was having euvolemic hyposmolar hyponatremia with a serum sodium level of 115 millimoles per liter. His 9am cortisol level, thyroid profile was normal with a urine sodium level of 90 millimoles per liter, which was elevated. Therefore, his investigation findings were suggestive of syndrome of inappropriate ADH secretion.
As SIADH can be associated with neuroendocrine tumors like small cell lung cancers, we did chromogranin levels which came out to be high, supporting our diagnosis. Our patient underwent pleural biopsy and it also shows deposits from neuroendocrine tumor, probably from pulmonary origin. He underwent multiple chemotherapy cycles, now having a good prognosis because of early diagnosis and early treatment. So, when we do a workup for SIADH, we need to include neuroendocrine tumors as a differential diagnosis, as this patient can present with hyponatremia in their initial presentations.